While hope of a vaccine is on the horizon, the United States is reminded just how serious a toll the coronavirus pandemic has taken. Wednesday saw the single highest day death count, and hospitalizations hit a record high, too. According to Johns Hopkins, the U.S. has seen nearly 14 million cases and more than 274,000 deaths since the pandemic began. The nation's leading infectious disease doctor, Anthony Fauci, is meeting with the Biden transition team today. Here is what he said about the possibility of more lockdowns in an interview with CBS News chief Washington correspondent Major Garrett for The Takeout.
I think the answer, even though people don't like it, the answer is going to be yes, because once you get to the point where you are stretching the hospital system, you don't want to be in the unthinkable situation of having to choose who is going to live and who's going to die. That's something that's just unimaginable. So the only way sometimes that you could prevent that is to do really stringent prevention. And in some areas, not all, in some areas, that may be a temporary lockdown. That is entirely conceivable. I don't think we're going to see that centrally for the country, but I think in some selected areas, they will have to make that choice. Either close down a lot of things or have the hospital system overrun.
For the latest on the coronavirus vaccines, I want to bring in CBS News MoneyWatch senior reporter Stephen Gandel. Stephen, welcome. Great to see you. So both the Pfizer and Moderna vaccine require 2 shots taken weeks apart, which complicates matters somewhat. You've been reporting on how significant it is for Americans to receive both doses of the vaccine. Tell us how you found vaccine efforts could be undermined if people only get 1 shot.
Yes, I don't think people understand how big the stakes are or how dire the consequences are if people only get 1 shot. I thought, and I think what the government seems to think, and others, not in the health profession, think, well, if people end up getting 1 dose and they don't get 2 doses, then they're just not going to be immune to the coronavirus vaccine. Well, it's much worse than that. If a lot of people, and I talked to some experts on this, they've been looking into it a while, experts on evolutions of viruses. And the concern is that if people get 1 shot and not 2 shots, and then those people get exposed to the coronavirus, the virus won't get killed off of them. It'll live, and it'll figure out a way to adapt itself and get around the immunization efforts, the vaccine, and then it could spread again. So the possibility of this, and so then we could have a vaccine-resistant strain of the coronavirus out there, and we'd have to start this whole vaccine process over again. We need some other new vaccine to get around the problem that just got created. Now, the chance of this, what I've heard, I know it's when I found out about it, I was not happy. So the chances of this are low, but if we don't do a good job of getting people back for that second vaccine, it could be millions, tens of millions of people. And the more people don't come back for that second shot, the higher possibility of this nightmare scenario.
That is a catastrophic scenario that you just laid out. So what plans then do public health officials have to ensure people return to get their second shot when the stakes are this high?
Well, unfortunately, when I talk to some experts, at least so far, they think the government hasn't done enough. The main thing that the government's doing, the main plan that's set in place is actually an index card. There's a lot weighing on an index card. The government has shipped, along with all the millions of doses that are getting shipped out, in that packet that hospitals and pharmacies and other vaccine administrators will receive, is going to be a 4x6 index card. It's a reminder card that tells you, and the CDC has instructed everyone, the providers, to fill out that card accurately, hand it out to people when they get a vaccine with the date of when their next vaccine has to be. They're 21 or 28 days away. And there's even in the official document instructions to tell people to take a picture of this card in case you lose it and it's on your smartphone. That doesn't seem to be enough, but it does seem to be the one thing that's in place. There are other plans in the works.
That so to me doesn't really seem like, sorry, go ahead.
No, you're going to say exactly what the expert told me. It's not enough. So the CDC also has a platform that was built to allow people to report when they have side effects. The CDC says that platform can be adapted to also push alerts out to people, either by text or by email. Then on top of that, states have lots of different systems that they've been putting in place for the last years. This has been part of a larger vaccination effort, but it's being mobilized for the coronavirus. Each individual state has these, they're called IIS, immunization information systems. The problem is they're not connected. The different states are not connected. You get one shot in one state and travel in another state, they're not going to know that you got it. Also, it's an effort that they were hoping to get done by 2024. And so only 25% of providers are connected to this, and states say they don't really have the money to connect the rest of providers right now.
Right. So many roadblocks. I mean, I could see a plan, kind of like that you mentioned, where people get continual texts on their phones until they get in for their second shot. But one of the other concerns is that, of course, sometimes people have a slightly negative reaction to vaccinations, which is totally normal, right? But sometimes you can have a little side effect of that you don't feel so well. And those people might be even less likely to go back for their second dose, correct?
That's right. One of the main hurdles of getting people back for this vaccine is that there will be a higher rate of side effects than there is, say, with a typical flu vaccine. A flu vaccine, it's, around 1% of people get some kind of what they call moderate side effects. For this, we're not sure yet, but we think it's more in the 20% range of people who will get some fever, or they'll get a headache, or they'll feel out of commission for a day or two. And that alone is could be enough to make you not want to get back for a second shot of that. But the other thing that's a problem is there's probably going to be, just like we've seen through this whole thing, a whole bunch of misinformation. And people are going to be worried, which will not happen. I've been told by many experts, you cannot get the coronavirus from the coronavirus vaccine. Not possible. But there's going to be people who believe that. And some of those people think, just like some people think they can get the flu from the flu vaccine, which you can't. So there's going to be people who think that. They're going to think, I got the coronavirus vaccine. I don't need to go back for that second shot, but you 100% do.
So aside from all of this, making sure that people go back for that second, shot, what other logistical challenges have you found for rolling this vaccine out? Do states have enough funding to do this accurately? What did you find there?
States don't have enough funding. There is $16 billion that we're talking about in the latest version of the stimulus bill. The question is, and that's $16 billion for vaccination rollout, but it's also for contact tracing. And it's not clear how much of that is going to be in the federal government's effort or how much of that's going to go to the states. So, and also, when does that happen, right? We're going to have this Pfizer vaccine within 2 weeks. A few weeks after that, we're going to have the Moderna vaccine. The money, even if it was approved now, getting that money out to the states would be, at that speed, would be problematic. So the states definitely need money. The Congress is aware of it, but it's being held up by everything else. And then the logistical problems are the ones that, exist throughout, whether it was one shot or two. I mean, particularly, and Pfizer, the biggest logistical problem is that these first vaccines have to be kept ultra cold. So that's something that hospitals have been dealing with too, getting deep freezers and other necessary resources that they wouldn't normally have to be able to distribute this very specialized vaccine.
Wow. So considering how this pandemic has been handled from the beginning, it's really hard to imagine, especially considering everything you've outlined, that this rollout is going to go smoothly as we need it to go. But of course, hope springs eternal. Stephen Gandel, thank you so much for joining us. We really appreciate it.
Nice to be with you again.